Yeah, now you can hear me.
I can hear you, Pat.
Hello, now can you hear me? Hello, Nadu. Hello.
Pat, I can hear you.
All right, sure.
Pat, can you see the screen?
Yes, I can.
Okay.
Nadu, the sound is not playing.
What sound? I'm coming. Let me change the audio settings. Can you hear the sound now?
No,
What about now?
no.
Yeah, after the call someone, yeah, try to put
Can you hear it now?
Do you know anybody that
Can you hear it now? Reggie, I made you co-host so you can
No,
admit them. Still,
no. Ah, yes, 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 yes.
the Regina be admitting people. But when you are ready, just let me know and I'll stop sharing the screen, okay?
Sure, sure.
Place.
Non puedo, porque también.
Hi everyone. I hope I'm audible enough and you can all hear me. You're welcome to today's webinar that is being hosted by Repo Health Unfiltered. Okay, I have a feedback that yes, we can hear. So this is a collaboration between Repo Health Unfiltered and FP 2030. I can see some few people online, and I would encourage that we share with our colleagues to also join from wherever they are so that we can have very, very fruitful discussions this afternoon. Today, we are looking at beyond contraception, what family planning has made possible. For some time now, for those who are following keenly, we would notice that there's a campaign ongoing on Made Possible by Family Planning. And before we officially begin, I would like to play a video on what's, or let me say, I would like to speak about what the Made Possible by Family Planning campaign is all about. Maybe for those who have been following keenly, I do not know if anybody would, I don't know, just like to share in the comments. That is before we begin officially with introductions and all of that. If you have seen the Made Possible by FB campaign anyway, you can just put it in the comments. Yes, I have seen. I think it is this. I think it is that. So we can start by getting interactive even before we go into the discussions. So if there is anything you have heard about the campaign, you can just put it in the chat. Oh, I've heard about the campaign. I think it's about this. Or I've not heard about the campaign. I don't know what it's about. You can just put it in the chat. Let's get interactive. If you know about the campaign, you can put it in the chat. And I'll just be going through the chat to read what people know about the campaign and what they do not know about the campaign. So if you have, please do just drop something in the chat to say that I know about the campaign or I've seen the campaign somewhere. Not necessarily, it doesn't have to be for me. It could be that you saw it in your timeline somehow. You can just drop it in the chat. And as I mentioned earlier, this is being hosted by, okay, so I see someone say, Alan says that, yeah, I've heard of the campaign. I think it's about family planning on Instagram. Okay, so Alan is saying that, yes, he said about the campaign and he thinks it's about family planning and he heard it on Instagram. Abiba says, heard about the campaign and it's about sharing impact stories of family planning by individuals. I think they are all correct. Any other? Anybody wants to share something? Anybody wants to share something? Anything they know about the campaign? Anything else? Okay, so I'll just move right into it. So my name is Patience Ampoma, and I'll be your moderator for today. I'm the FP 2030 Youth Focal Point for Ghana. I also work with the Planned Parenthood Association of Ghana as the Advocacy and Communications Lead. I welcome you all to today's discussion or today's webinar. Today, I have some very powerful people with me as panelists, and I'm sure you would enjoy the conversation so much. I don't think you would even want us to close. So what is actually the Made Possible? Okay, so Lillian says, I've been following the campaign closely on social media. Right, so now the question is, what exactly is the campaign about? Now, the campaign is led by the FP 2030 Global, and what the campaign is about or what it intends to do is to be able to raise 1 billion USD in funding and commitment for family planning. So that is what campaign intends to do. It also intends to spark new leadership and voices from highly influential actors to ignite momentum. What else? It seeks to establish a new narrative of family planning. So we don't want family planning. People just talk about family planning, and the whole concept is that it's people just focus on the misconceptions and the stigma and all of that. But now we are moving into a new narrative, and what we want to say or what we want to preach now for FP is the development aspect of it. We want to showcase the development aspect of FP for people to understand that FP moves beyond health. It's just not a health issue, but now FP is the bedrock of development. So linking family planning to the various sectors of development, that is what we want to do for FP. And today I'm joined by three powerful people. I told you I have with me the program manager. I have with me Dr. Doris Ayele Amatefiu, who is the program manager for family planning and comprehensive abortion care from the Ghana Health Service. Doc, can you just wave us? Can you say hi?
Hey.
Okay. Thank you so much, Doc. I see that Doc is ready and she's going to take us through today's discussion. It's going to be lovely. I also have with me Mrs. Onyinye Vincent. She is the founder and chief empowerment officer she's the founder and chief empowerment officer. Mrs. Onyinye, please, can you wave? Can you show your camera? Can you show your face and wave at us if you can hear me?
I can hear you. Unfortunately, I'm not going to be able to use video, but I hope you can hear me audibly. And I try to make sure my picture is available. So just imagine I'm waving at you from Maryland.
Right. I can only imagine. So this is the picture of Mrs. Onyinye. So Ms. Onyinye, please say hi to us.
Hello. Hi. I bring you warm greetings. I'm excited to be here. Thanks for having me.
Okay. Thank you so much for agreeing to participate in today's discussion. Then last but not least, we have the gentleman among the ladies. His name is Jutom Dotien. He is the FP 2030 Youth Focal Point for Liberia. Can you say hi if you're on the call, Jutom?
Hello, everybody. Hello. Patience, thank you for the invitation. And I want to say a big thank you to all of the participants joining us this time. Like Oyeyen said, unfortunately, I cannot, turn on my camera because I'm in a low transit trying to get somewhere else. But again, it's a pleasure to be here, and I look forward to the success of this program, the contribution, the conversation. Of course, it's going to be very meaningful. So I encourage all of our participants to take pens, your notebooks, jot down questions if you have, and let's have a great time together. Thank you so much, Patience. Thank you.
Thank you so much, Jitum. I know that you really do have a busy schedule, but you still made time to join us. All my panelists have quite busy schedules, so pulling them here was very hectic, and I'm very appreciative that they were all able to make time to join me this afternoon. Right, so I'll just go into the introductions. So for those who just joined us today, we are talking about beyond contraception, what family planning has made possible. And I would like to give a brief introduction of our first panelist or our first guest speaker, who is in the person of Dr. Doris Ayele Amatefiu. So she's the program manager for family planning and comprehensive abortion care at the family planning at the Family Health Division of the Ghana Health Service. at the Ghana Health Service. She's a professional nurse midwife with extensive. Who is speaking? Okay. She's a professional nurse midwife with extensive experience in reproductive, maternal, newborn, child and adolescent health. She holds a PhD in medical sociology from the University of Ghana. She has led and contributed to numerous national initiatives and technical working groups focused on improving maternal and newborn health outcomes. Her work reflects a strong commitment to ensuring equitable access to quality reproductive health services and advancing the broader transformative potential of family planning in Ghana and beyond. So that is about Dr. Doris. She works with the Ghana Health Service. I will move to speak about Mrs. Onyinye. I'll move to speak about Mrs. Onyinye. So Mrs. Onyinye, her full name is Onyinye Ide Vincent. I hope I'm not butchering the names and I am mentioning them as they are supposed to be. So she is the founder and chief empowerment officer for Strong Enough Girls Empowerment Initiatives. She's worked over the years advocating for rights of girls and women across the globe. And she's a champion when it comes to gender equality, women's empowerment. And anywhere that you see her, you see that she's championing rights of girls, talk about family planning, talk about LGBT, just anything sexual and reproductive health and rights. You see her there, and her foundation or her organization, which is a Strong Enough Girls Empowerment Initiative, as the name suggests, is focused on ensuring that they provide empowerment for girls across the globe. Now, the last but not the least person that I would give a brief introduction about is Juto. Juto, am I mentioning the name correctly? Is the name correct? Am I giving the right pronunciation for this?
You're doing a great job.
Right. So he is the FP 2030 Youth Focal Point for Liberia, first off. And he's an accomplished international development enthusiast and human rights advocate with decades of experience. He's currently also the executive director of Youth Arise for Development, which is a youth-led non-profit organization. Jutom's exceptional contributions have earned him numerous national and international honors, including the International Family Planning Trailblazer Award in 2022, the Mandela Washington Fellowship in 2024, the International Visitors Leadership Impact Award in the US, and the Early Career Research Award, amongst others. So there's just something brief for us to know the people that are being engaged today. So you realize that we have the right people for the conversation. They would give us their experts' views on the topic on board. Once again, a big thank you to Ripple Health Unfiltered for hosting this webinar. So let's zoom right into our discussions. And my first question will go to Dr. Doris from the Ghana Health Service. Doc, are you there? Hello, Doc.
Oh. Hello, I'm here.
Right. Doc, so from the health system's perspective, what life outcomes have you seen change when family planning access improves? Is there any story that you would like to share with us? Because today we are looking at beyond contraception, what family planning has made possible. Is there any story that has stayed with you over the years that you have worked in the health sector? when it comes to FP?
Okay, thank you very much, Madam Patience, for this question. It is very critical because as we work as policy implementers, service providers, we need to look at things that happen in relation to the work we do, the policies that we put out there. And listening to this, your question, it reminds me of one young pregnant lady. And I want to start by saying that when we talk about family planning as a driver of transformation, looking back at this young lady, I can say that this lady's story is a true reflection that family planning is a driver of transformation. I always think about this young lady to actually not mention the actual name, but make it a pseudonym. I'll name her Salamatu. And she's from the northern region. When I met this lady some few years ago, she was just 16 years old. And she was pregnant with her first child. And because of that, she had to drop out of school. From her interactions that I had with her, she was actually married. She was married at that young age, and it was a forced marriage. She wasn't happy to be married at that time, but because of her background, it was accepted that a man has come to marry her and they have actually given her out for marriage. So because of that, she had to drop out of school and become a married woman at 16, which she wasn't happy about. So she moved on to deliver. After delivery, she told one of the nurses that she wanted to go back to school, but she was afraid that because she's still married, another pregnancy will end her dream completely. This lady was sat down, spoken with her, we counseled her, and through the adolescent health corner at her local CHIPS compound, she received this counseling, detailed counseling, and she accepted a contraceptive method. With that support, she returned back to her school, completed BEC, and later enrolled in a vocational training center. Today, as I speak with you, she runs a small catering business, and she often comes back to mentor other girls in her community. One day she said, family planning gave me a second chance. It helped me take back my education, my confidence, and my voice. For me, this is what family planning makes possible. It gives young women like my lady the power to make choices that shape their futures. They are able to go back to school. They are able to learn a trade. They are able to lead. And when girls have this kind of control, it doesn't only benefit them as individuals. The benefits ripple outward. Families become stronger, communities become more resilient, and the nation reaps the rewards as well. So when we invest in family planning, we are not just preventing unwanted pregnancies, because when you look at this lady's story, it is not just about being given the contraceptive method, but through the contraceptive method, she was able to actually regain her confidence, her voice. She was able to go back to school. So when we invest in family planning, like I'm saying, we are not just preventing unwanted pregnancies. We are unlocking potentials. We are making it possible for every young woman, no matter where she lives, to dream, decide, and determine her own future. So this is how I see family planning as a driver of transformation. So I think I'll pause here for now for my other speakers to add on. And then when there is time for me again, I can add on. Thank you very much.
Thank you so much, Doc. That was very insightful. When we invest in family planning, it's not just about investing, it's not just about avoiding pregnancy, but it's more about unlocking potentials wherever the girl is so she can dream, decide, and determine how her future can look like. This is just the beginning and it's already exciting. So if you're on the call, I hope you stay till the end so you see how excited it gets, even though we see the excitement right from the start. Mrs. Onyinye, so this question is for you. Are you able to share an example where access to family planning shifted a community's development path or perhaps changed a young woman's trajectory, just like the context of what has been shared by Doc? Is there any example that you like to give? Access to FP shifted the community's development path or changed a young woman's trajectory?
Yes. So thank you so much for the question, Patience. Thank you, Madam Doris, for your contribution. I totally align with what you said in terms of the broader benefits that go beyond just giving a contraceptive to a girl. So yes, it's always good to practicalize these things we talk about. As somebody who has worked in sexual and reproductive health for about a decade now, I always ask myself, okay, this thing I'm preaching about, use family planning. What are the impacts on community members? What are the individual impacts? And I think I want to start with my own self personally. What impact has family planning made on my life? And then I'll also share a couple of examples of communities or people in communities that I work with. So on a personal level, I would say, thankfully, I grew up in an educated family and where education was always prioritized for me. And just to keep the story short, for me, being able to have an education allowed me to learn about my sexual and reproductive health. And as a result, I made wise decisions when it came to sexual relationships. Personally, I chose to be abstinent, but when I got married, and now I have a 15-month-old son. I know that being able to access family planning is what is helping me enjoy my marriage. And I know a lot of young people here are not married yet, but I just want to say from a personal standpoint, having access to family planning has allowed me not just to enjoy my marriage, but to stay in my career, to continue working to empower young people with the knowledge and the skills they need, but also to pursue. I have a master's degree. I also am currently pursuing my doctorate. And interestingly, I had to defer my doctorate last year because I had a child. And for many young people, having a child actually ends up in them having to drop out of school. But thankfully, I could choose not to just drop out totally, but to say I want to give myself a year to bond with my child, for my body to heal. And family planning allows your body to heal. That's something I want to tell a lot of women, especially African mothers. I've seen women take in within 4 months to 6 months of having a baby. And I'm like, how did you allow that to happen? And that's why we lose a lot of mothers to childbirth complications. But yeah, so on a personal level, family planning has allowed my body to heal. And because of that, I'm able to progress in my own personal goals for myself and pursue my career, but also to enjoy a great family life. Because if I'm being stressed by having children, multiple children at the same time, I'm not going to feel like I'm getting loved, or it's just going to feel like there's a lot that I have to handle, because children are very precious, and you have to invest your time and resources in them. So financially, you have to make sure that you are in a place where you can accommodate having even one child, not to talk of multiple children. So that's on a personal level. But in the community, so as you talked about earlier, I have a nonprofit organization called Strong Enough Girls Empowerment Initiative. And part of our program is that we have young people who are champions for family planning. And when I ask them what has been the impact of family planning on their personal lives, I just want to share one of our champions. She tells me that she has noticed a significant impact on access to family planning in her life. It not only allowed her to take control of her reproductive health, but it also allowed her to ensure that she can pursue her own personal goals. She talked about how she also learned that when you're trying to find a family planning method, you have to find the one that suits your body, and your health needs. And I want to highlight that because as much as we talk about the benefits of family planning, there are a lot of people that also struggle with the side effects of family planning. And unfortunately, many community members will hear about the side effects and then they'll begin to propagate some myths about family planning. But for this young person, she has been able to benefit from a family planning method that works for her own body. And she has a child now, and she's a single woman. So being able to access family planning is helping her take care of this child that she has, but also pursue her academic goals and also try to get a job. And then another lady also told me that she has two children, and family planning has allowed her to also pursue her dreams. So I think when we see the value of family planning, it's usually in the light of helping individuals fulfill their greatest potential to pursue their dreams. And on the community level, when individuals are pursuing their dreams, we see things like less crime. We see things like less dropout of school. We see better leadership, because the people who are becoming leaders are people who have had the chance to go through school and not drop out because of a teenage pregnancy. Or for the boys, when they become parents or fathers at an early age, they are facing a lot of stresses. So they become drunkards, or they resort to illegal means of getting money. So at the community level, we see that access to family planning promotes peaceful environments and also promotes economically viable communities. So I think I will stop there, and happy to share more as time goes on. But thank you.
Thank you so much, Mrs. Onyie. So for those who joined before the conversations just when the conversations were ongoing, we are talking about beyond contraception, what family planning has made possible. And just to highlight a few things that Mrs. Onyie mentioned, she said personally, FP made her body heal. She's enjoying a great family life, and she's able to balance family and work and achieving her career goals. And for the impact with the girls that she works with in her non-profit organization, some shared that it's helped them pursue their dreams, their academic goals, and generally, when there's access to family planning, there's less crime, there's better leadership, and it promotes peaceful environments. I think these are some of the key things that when we are talking about family planning, we should be able to sell out or let people understand that at the end of the day, in as much as the bit of contraception is also important that we highlight, we need to also let people understand that beyond contraception, what actually is family planning helping you to achieve. And some people tend to think of the fact that, when we are talking about family planning, we are saying that people should not give birth. But here we are, Mrs. Onyia just mentioned to us that she is enjoying a great family life because, of course, she does have kids, even though she's still taking you is also very important. So just to highlight before I move to Jutom to ask a question, it is very important that if you decide to take up a family planning method, you just don't sit in a room and decide and just go to the facility and say that, I want this method. You should be able to have a conversation with the professional who is the service provider on what method suits you, what method will suit you better based on the counseling that is given. Now to Jutom, you work directly with grassroots youth. What have you seen FP make possible for young women and girls that statistics do not usually capture? The statistics will give us the number of maybe girls who have used FP between the ages of this and that. But on the ground, we are being very realistic as we can. We are not doing notebook stories. We are sharing the personal stories. So on the ground, as a youth advocate, what have you seen FP made possible for women and girls? Okay, he's on the line, but he's not speaking. So whilst we wait to us, I'll go back to Doc and ask a question surrounding policies when it comes to family planning. So Doc, to be very specific, let's talk about the area that you work in, which is in Ghana.
Hi, Patience.
Okay, so we have you here.
Yeah, I'm so sorry. I was muted and I thought I was unmuted.
All right, so
Yeah, so thank you, Patience. I'd like to start by thanking Dr. Doris, Oyeyen, and all of the young people and our participants who have joined this educative dialogue today. I want to thank you in particular, Patience, for taking up your time ex-
Tom, so you keep breaking. Your line keeps breaking.
Apology. I had a local call, so I'm sorry for that. Yeah, so to answer your question, I will first of all like to start with my own story. I was brought by two beautiful parents who knew absolutely nothing about family planning. And the dream of my father, of course, was to go to school, become educated, get a job, and take care of his own family. But unfortunately, in 12th grade, that was his senior year, he impregnated my mother. So now the dream of completing high school and going to the university um, is one that actually came to an end. And then he had to focus on taking care of a child like me. Now, adversely, I grew up knowing the story that my father once had such a dream. And then I said to myself that I was not going to repeat such a mistake made by my father. And of all of the different solutions, I felt that family planning would be the best solution. So I began adequately using condoms. And of course, I graduated from university without a kid. Now I don't have a kid, but one day I hope to have one. And you can see that my dreams, of course, are coming to fruition gradually. What I have seen family planning make possible goes far beyond what the numbers can ever show. I have met young women in rural communities here who once believed that motherhood assisting was the end of their dreams. I've also seen young boys who felt like, you know, fatherhood was something very, very important to them. And now, because of access to family planning, they're absolutely back in school. Some of the boys and girls I see now are able to run smaller businesses And because of family planning, like me, a male champion for family planning, is able to mentor thousands of young boys and girls. The truth is that family planning doesn't just prevent pregnancy, it restores confidence, dignity, and choice. It gives girls the courage to say, I have control over my body and my future. And these are things statistics rarely measure. The smiles of girls returning to classrooms, the mothers who can now space their children and work, and the sense of freedom that comes when a young woman finally feels she owns her own story. So that's it for me. Patience. I think family planning is very powerful. It's a solution to most of the worst problem, and if we see it like that, it's gonna make a lot of things possible for all of us, just as I have experienced. Thank you.
Thank you so much, Shitom. So family planning is the solution to most of the world's problem, and if we see it like that, is going to make a lot of things possible for us. So even if you live here with nothing, live here with the understanding of how family planning transforms life, or how transformative family planning is for people, most especially young people. The fact that family planning restores dignity and gives choice to women to take control over their careers, over their futures. It's not just about taking control over their bodies. It moves beyond that. It's about taking control of their careers, of their futures, and of course of how many children they want to have, how they want to space their children, and all of that. So now I'm moving to Doc. Doc, in Ghana, when it comes to the policy environment, so this question is going to center around if FP is truly a developmental tool, where are we currently winning and where are we failing? So from all the conversations we have had, one thing that is similar, or one theme that runs through everyone's presentation, is the fact that family planning is a developmental tool. So my question now is, where are we currently? Are we winning? Are we failing? What's happening? I'll start with Doc. So maybe we can speak in the context of the various countries that we come from before we can give a global perspective. So Doc, maybe you can tell us for Ghana, Onyinye, you can tell us for Nigeria, and for Jutom, you can tell us for Liberia. So I'll start with Doc from Ghana.
All right, thank you very much, Patience. And I'll thank all my other colleagues for such wonderful inputs. And so when it comes to family planning as a developmental issue, Ghana is actually, let me say, we are doing well. We'll come to some of the few challenges that we have, but we are doing well, because if I should look at family planning as a developmental issue, then Ghana is looking at family planning policies that will look at poverty reduction, how to reduce the lack of access to education or healthcare. Ghana is looking at how family planning can focus on environmental degradation, gender inequality, and any other developmental issue that we can think of. Ghana is looking at family planning as means of addressing such challenges. So when we look at family planning, you look at the FP 2030 commitments, and you look at NHI's inclusion for family planning services. This is one area that will improve access to family planning. Once we are able to increase access, then a lot of people will get access to family planning, including adolescents and girls, including the people with disabilities or persons with disabilities, so that poverty can be reduced. And so based on this, Ghana is committed to NHIS inclusion into family planning services. A chunk of our family planning commodities are being sponsored or being paid by the NHIS. So all you need is to be registered on the NHIS and then you are good to go. So Ghana has this policy for family planning. So increasingly, Ghana is integrating family planning into broader national and productivity agendas. And this is through several deliberate approaches. I've mentioned our NHIS, and then our policy framework recognizes family planning as a driver of socioeconomic growth. For instance, the National Population Policy, the Health Sector Medium-Term Development Plan in Ghana, the Family Planning Costed Implementation Plan, all align family planning with human capital development and poverty reduction goals, like I've mentioned. And the logic is simple. When women can plan their pregnancies, they are more likely to complete their education. They will join the workforce and contribute to economic productivity. So this is a means of actually tackling poverty. This is an economic and developmental policy. And secondly, through the FP 2030 commitments, like I said, Ghana has positioned family planning within domestic financing and social protection policies. I've already mentioned the National Health Insurance Scheme and increasing government funding for FP commodities. So in the past, Ghana government was supporting FP commodities with 5%. Currently, government is looking at supporting with 20% of commodities procurement, because we see family planning as a social protection policy. So these are some of the things that Ghana is doing. And these shifts the narrative from donor dependency to national investment, because we see FP as part of economic resilience and fiscal responsibility. Currently, we have some of our donor partners leaving us, like USAID, Stop Order, and all that. And because we see family planning as a domestic financing and social protection area, these policies are being looked at so that we can actually bridge the gap that we are looking at because of some of these partners that are leaving us and some of these top orders. Also, Ghana works to strengthen communication, framing family planning as smart economics. We highlight evidence, and there is the evidence that every cedi invested in family planning yields multiple returns through reduced maternal deaths. It lowers dependency ratios, and we have higher GDPs per capita. We are now engaging the Ministry of Finance, Gender, Education, Employment, and more deliberately, we want to make family planning part of our conversations about productivity, youth empowerment, and sustainable growth. So through SBCC, we are making this information available for people to know that when we talk about family planning, it goes beyond, protecting yourself against pregnancy. But once you space your births, you plan your pregnancies, you are able to achieve a lot. You are empowered as the youth, you are empowered, and then there is sustainable growth. So ultimately, I'll say that family planning is not just a side issue, it is a foundation for national progress. And it influences the size of the population and subsequently the health of the population and the skill level of our future workforce. So yes, we are working to make sure FP is communicated and financed as part of Ghana's economic policy, not only as a health intervention. So Ghana is well versed. We bought into this idea that family planning is an economic and developmental issue, and we haven't slept on it. Government, stakeholders, partners are all working together to actually achieve this dream. And I'll end it here so that when there is more time, we can delve deeper into it if there are anything to address. Thank you very much.
Thank you so much, Doc. Thank you for giving us an overview of what is happening in the country when it comes to family planning. So much has been said by you, and I like the way you've been able to give us the breakdowns on how everybody is contributing. And even someone might say, SBCC is very minute and is the last thing that we should talk about when it comes to FP, but yeah, we are using SBCC to transform the narrative. Thank you so much. And I like the fact about how Ghana is committed through the National Health Insurance Scheme. So now it means that when you have your health insurance, all you need to do is to walk to a facility, right?
Yes, absolutely. Absolutely.
Right. That is very, very exciting. Does this include something like condom, or with condoms, unless maybe the pharmacies?
Condoms are inclusive.
Okay.
We have higher contraceptive methods, let me say LNG, IUS. That's one. There is still conversations around it as to how to incorporate that. But then we are working towards that. But majority of the products are under the National Health Insurance Scheme.
Thank you so much, Doc. Every city invested in family planning reduces maternal mortality. I think that is one key thing I'm taking away from the second presentation that you have made. So now we zoom into Mrs. Onyinye. I'm sure that she's made all her points ready for submission. So Mrs. Onyinye, you have the floor. Can you give us a brief context when it comes to Nigeria and possibly on the global scale, if you are able to have any information on that?
Yes, sure. Thanks, Patience. And Dr. Doris has really kicked us off in terms of thinking of the policy shifts that countries are adopting. And of course, as she mentioned, Ghana is an FP 2030 commitment maker, as well as Nigeria and many other countries across the world. But when it comes to policies, of course, we all know the same rhetoric that it's one thing to put things on paper and to actually see them implemented. But I think in a context of limited and actually decreasing funding landscape, we need to get creative and we need to get innovative in how we position family planning as not just a health sector issue, but as a broader development accelerator, if I should say. As Madame Doris said, in Ghana, FP is positioned right now as economic resilience and fiscal responsibility, also a social protection mechanism. If countries were to think of family planning as protecting the society, as I mentioned earlier, from things like violence, from things like poverty, from other ills that are due to constrained resources. When we position family planning as being able to help us achieve economic growth and sustainability for countries, I think we would see more progress being made to advance access to sexual and reproductive health information for more people. Specifically for Nigeria, I should say there are legal and regulatory barriers that impact young people's access to family planning or sexual and reproductive health services. We need to look at our age of consent and also the discrepancy that lies in some of these policies because we have laws that criminalize sex outside of marriage. And then also age of consent rules keep young people from seeking sexual and reproductive health services. And for the providers, it creates confusion for whether or not they are allowed to actually provide those services. So we need policy that is very clear and also ensures that young people are able to access these services without needing particular guidance. I understand there's a reason why consent matters, but when we look at the bigger benefits of ensuring that young people have this access and ensuring that it's comprehensive access, that they have an accurate access in terms of the information they're getting, then we know that we don't need to worry about the wrong information or the wrong methods getting into young people's hands, because we know that the health workforce or whoever is supposed to be providing these services would have the required trainings. So yes, we need a complete implementation of comprehensive sexuality education. So Nigeria is a country that has had comprehensive sexuality education in existence technically for about 30 years. That says, we call it family life and HIV education. But what we see is that while these policies exist on paper for schools to actually teach family life and HIV education, we see that it's not fully integrated into school curricula. I actually worked as I was working as like a monitoring officer a few years back in schools, where I would just go and sit down in classrooms and observe how teachers were teaching the curriculum. And I noticed that a lot of them were watering down what they were teaching because of religious and social perceptions or beliefs about what young people should know about sexual and reproductive health. So we need to ensure that these issues are being addressed so that young people can get accurate and complete information that they need for the stages of development that you're going through. Also, there's currently in Nigeria lack of youth-friendly and confidential services. When we talk about youth-friendly, we need to ensure that there's privacy, there are trained staff. I mean, I don't want to repeat these things because these are the things that we know we should be doing. So I'm just going to summarize in regards to what I think we need to prioritize right now. And Dr. Doris talked about the funding landscape. So where we see that we have chronic underfunding because of reduced foreign aid, we need to start thinking innovatively domestically. How do we mobilize funds to ensure that young people are getting the services that they need? And this will entail connecting with private sector partners that we have left out of the conversation. I started my response by talking about not making family planning just a health sector issue, but we need to talk about family planning when it comes to climate resilience. We need to look at family planning when it comes to education. So when we start to think of family planning more broadly, we can get the kinds of funds, we can diversify the funding pool to ensure that we can use these funds to address issues of population and population size. So we need to position family planning as a development accelerator that contributes to multiple sustainable development goals, including SDG 1, which is on poverty reduction, SDG 5, which is on gender equality, SDG 4, as I mentioned, education, climate resilience, which is SDG 13, and economic growth, SDG 8. So when we integrate family planning indicators into national SDG monitoring frameworks, we would see the complementarity, and we'll find better alignment for how we can use funds to address not just an education issue, but also a family planning issue. And the last thing I will highlight is that we need to move from the narrative of family planning as population control to reproductive justice and agency. Right now, family planning narratives are emphasizing demographic targets rather than individual choice and rights. We need to reframe family planning as a matter of human rights and social justice. It's not just about the numbers. It's about the quality of life. So when we come up with policies, our policies should be measuring success by empowerment and satisfaction. Are women living happy lives? Are men happy with the lives that they have right now? Rather than just looking at contraceptive prevalence, but how are we looking at how are societies empowered because they have access to family planning methods? All right. I hope that addresses the question, but these are the areas I think we need to shift and reframe the conversation in order to make the progress that we want to see. And really not stigmatizing family planning. It's really about sustainable development for all. Yeah.
Thank you so much. I think today, by the time I'm leaving this session, I will have my notebook full because the kind of information we are getting today, I think it's very rich and very insightful. So the question I'm taking away from your presentation is, how are societies empowered because of family planning access, and the need to reframe family planning from, the demographic, from all the numbers, and focus more on human rights and social justice. And I like that you touched on the various SDGs that we can have, the actual linkages. We looked at SDG 1, we talked on SDG 5, SDG 4, and SDG 8. So I think as youth advocates on the call, when you go back and we are having our various X chats, we are having our various X spaces within us, amongst or within ourselves. These are some of the um pointers that we should be looking out to discuss. These are some of the areas we should be looking at to discuss. How can we reframe family planning into human rights and social justice, than just, talking about family planning with the demographics, and the MCPR, and all of sometimes the huge words that some of us or a lay person finds it difficult, to understand because of its technicality. Thank you so much, Mrs. Onyine, for giving us that breakdown. It was very insightful for me. Now we move to Jutom. Jutom, as a young person, tell us generally the context in Liberia. Then you can also give us what youth often face when it comes to barriers, when it comes to so beyond stigma, the issue of stigma, I think Mrs. Onyie did mention that those are the things that we already know. We already know what to do and what not to do. But I just want to get your perspective on beyond stigma, gatekeeping, the age restrictions. What accountability mechanisms should we be pushing for? So you can give us a general context when it comes to Liberia. Are you winning? How is the FB space like? Then you can tell us that beyond the stigma and the age restrictions, and the religious and cultural barriers, what are some of the accountability mechanisms that we should be pushing for?
Patience, thank you for the question. Like never before, we're fighting against tokenism. One morning, the Ministry of Health calls 100 youths in the community and say, come to a workshop. And after the workshop, we all receive like 10 USD and we are happy going home. Then they make the policy, implement the policy document, and the other day they call us again and say, yeah, we've done X, Y, and Z. I think it's more beyond that. I'm talking about meaningful youth engagement. In Liberia, we've watched young people go to a health facility where they are not respected, you know, where they do not get, the adequate medical care, and the list goes on and on. Now, in my experience as a youth focal point for family planning in Liberia, And I've come to realize that we need more accountability mechanism. Case study. FP 2030, back then called FP 2030, saw the need to bring youth focal points, as a key component to the country team. That was because FP 2030 saw accountability as key to the country's commitment, where young people can sit on the table and say, by 2030, we want our government to achieve X, Y, and Z. And ever since FP 2030 brought young people to the FP 2030 network, we've seen tremendous progress. Young people are able to, you know, have their say in decision making, in policy making, and the list goes on and on. So we cannot really overemphasize the need to have accountability mechanism in the context of family planning. So in Liberia, um, we've been able to really bring young people to the table. We've had series of consultative meeting with young people. Prior to Liberia making her 2030, her family planning 2030 commitment, we had series of consultative engagement with young people. Liberia's about to make a commitment, and I'm gonna tell you this. Before Liberia even made her 2020 commitment, but then young people did not know what Liberia, the kind of commitment that Liberia made for the government made on behalf of the country for Liberia family planning 2020 commitment. But in 2030, we said no. We've already learned a lesson. What are those decisions you're making on behalf of us? We have to be at the table, because at the end of the day, we are going to the health facility to access health, the different services in family planning. So it's important for us to be on the table. And we have made some progress towards that. Have we achieved a lot? Do we need to do more? I say yes. We need more accountability mechanism. We really need scorecards. FP 2030, yeah, Liberia has made her FP 2030 commitment. Ghana has made FP 2030 commitment. Nigeria has. Many countries have also made theirs. In the context of Liberia, we want to reduce teenage pregnancy to about 27% by 2030. By the way, teenage pregnancy is very high in Liberia. Now, what we need to do, one accountability mechanism we need to put together now is, for example, the scorecard, to be able to determine, the progress that Liberia has made to achieving her commitment. What about organizing a youth pioneer? Okay, a youth pioneer where young people are placed at the Ministry of Health to track the government's progress in family planning. Those are some accountability mechanisms that we need. And I think they are very much important. I can go on to talk about an advisory pioneer. The United Nations, has established what we call the United Nations Youth Advisory Panel in Liberia to hold the United Nations accountable. I'm fortunate to be part of that. So we are able to ask all of the hard questions. We're able to know exactly what the United Nations is doing in Liberia and globally. So we need all of those accountability mechanisms. And finally, funding partners must be able to require transparency and youth inclusion from grantee, meaning that if you are funded to serve young people, they must have a say in the design, the monitoring, and implementation, and even talking about the evaluation of those projects. Yeah, so Patience, thank you for the question. We need more accountability mechanism. We've passed the level of talking nation, gone are those days when you just call us to a meeting and then you tell us, you guys are going to go into 4 groups. You know how they say those wonderful words. You guys are going to go into 4 groups. These are the topics you have to address, and at the end of the day, we take money. We want to form part of the decision making. We want to form part of the implementation. We want to form part of the monitoring and evaluation of every policy that has to do with family planning, sexual and reproductive health and rights, including our national and international development. Thank you.
Thank you so much, Jutum. So we want to move beyond tokenism. We want to be at the decision-making table. We want to see meaningful youth engagement. We want to ensure proper accountability mechanisms through the use of scorecards, the use of youth pioneers to track government progress when it comes to family planning. That was very insightful, and I could not just see, in fact, I could feel the passion with which Jutum is speaking. And if you're a young person here, I'm sure that one way or the other, some of us have experienced tokenism in the various spaces that we are in, one way or the other. And if you just joined in the discussion today, we are talking about beyond contraception, what family planning has made possible. We are being hosted by Repro Health Unfiltered, and this conversation is a collaboration between FP 2030 and Repro Health Unfiltered. As the conversation is going on, if you have a pressing question that you can't wait for us to finish the conversations, you can always drop it in the chat. And just for us to know, some one or two people who are also on the call, you can just mention your country in the chat so that we can get interactive in the chat as well. We will be ending very soon. It's just quite unfortunate because the conversation is getting like very exciting. Before I move into the latter part of my questions, I'm going to play a brief video on the campaign, because one of the reasons why this conversation has come up is because of the campaign on Made Possible by Family Planning. So I'm just going to play this video and I would like to get confirmation if the video is audible and we can all hear. So I'm starting. Can I get a confirmation if we can hear the video?
No, please, we can't
From my
hear.
end, no.
No, it's not playing either.
It's not playing?
No.
Wow. Okay, just a minute.
We can see your screen, your desktop. So maybe you stop sharing and then share the video part.
Okay. So I'm going to try this again, and if it doesn't play, I'll find a way to share with others. But if it does, then we are good to go. So I'll try for the last time, and then hopefully it should play. Oh, Nadu, so I'm forwarding this video to you, and please try to see if you can share from your end for us to view, please. So I'll just share it with the convener for Repro Health Unfiltered to see if she can share from her end, whilst we prep to move into the last round
Of her office, she's not there.
Right. So let's just move into the last session of the questions. The video will be played definitely before we move away from our discussions. So the video just gives us a better understanding, or increases our understanding when it comes to the Made Possible by Family Planning campaign, which is led by FP 2030. So we are moving to call to actions, and I want to ask a question. Jutum, I know you were the last person to speak, but I would like to bring you back. And before I engage the others, the part about tokenism that you spoke about, is there any breakthrough moment you would like to share with us? Because I realized you spoke about tokenism, you spoke about meaningful youth engagement. Is there any breakthrough that, as a young person, I know you've traveled, you've been in a lot of spaces. Is there any space that you have been in that you felt that, this is beyond tokenism, and I think I am at the decision-making table, and I have been able to reach, or my contributions have been part of the decision that has been made?
Yeah, patience. That's an important question. FB 2030 is an example, very glaring example. You know, through FP 2030 as youth focal points, we've been able to really not just form part of policy making, but we've been able to influence high level decisions both in our countries and internationally. We've been able to reach the last mile, improve the sexual and reproductive health and rights of vulnerable adolescents. So we can go on talking about a lot of breakthrough when it comes to meaningful, how you call, being at the table, meaningful youth engagement. FP 2030 has really done a lot for most of us, helping us to directly engage our ministers, who attend those fabulous conferences. We've been able to sit on the table with them, hear from them what progress our country, for example, Liberia, is making in sexual and reproductive health and rights. What challenges we are faced with. We've been able to get all of those. In my country, for example, also the United Nations platform has been one of the very difficult platforms to sit at, because the UN is a very complex body, and to understand what they do and all of those things is very difficult. Becoming a member of the UN Youth Advisory Panel, I felt like, yeah, I've reached somewhere where I'm able to really sit with the UN resident coordinator and to ask her the difficult question. And there brings in advocacy, smart advocacy, where you sit with the decision maker and to ensuring that the voices of young people, the girls who are dropping out of school because of unwanted pregnancy, stay in school, the boys who feel like they do not have adequate access to education, would like to involve in drug abuse, will avoid taking drug and reconsider their decision. For boys who will say condom is not a family planning method, so I'm not gonna, prioritize it. They'll start to prioritize everything. So those platforms have really, really, really been helpful, and I could go on to talk about the International Coalition of Sexual Reproductive Rights, and those have been platforms that have given us the voice. We have the energy as young people, but when we do not have the right platforms, it is often a problem. So I'm very grateful that we are making progress, and I'm very proud to sit with you, patients, and other young people from around the world on platforms that make us to hold decision makers accountable. We can ask questions, but essentially we are able to form part of the decision making. Thank you.
Thank you so much. So the video will be played. I really want us to play the video before our speakers give their last call to action. I'm ready. So the video will be played. So just give us like 30 seconds and then we would have the video on our screens.
Family planning is the silent driving force behind many of the opportunities and advancements we enjoy today.
As a mother and a professional, I understand the importance of being able to plan for the future, and not just for myself, but for my family and the communities around me.
As a Nigerian footballer, I've seen how family planning doesn't just change lives, it transforms entire societies. It has helped me to balance my family responsibilities and have a sustainable career.
So being able to invest in both my career and my children is a privilege, and I don't take that lightly at all. I'm working with FP 2030 to continue supporting the systems that help make that possible at a time that is urgent.
But as you join this campaign, I also want you to do at least two things. Retweet if you're still on Twitter. Do join many of the other social media platforms about what else family planning can do. The family planning makes choice possible. And as they say, the opposite of poverty is choice. And women out there, there is so much more that you can do with your life if you choose family planning.
Raise your voice and share your story with me.
Right, thank you so much, Nadu, for playing that video for us. So the essence of the video is just to let us know that we are all a part of the Made Possible by Family Planning campaign. And it really lies with us to share across all our various platforms. I don't necessarily need to lead it before you can share on your platform about what family planning has made possible. You can always share, tag FP 2030, tag your colleagues, tag anybody that you can tag Mrs. Onyinye, you can tag Doc, you can tag myself, Nadu, anybody you see on the call, all the PD people that are on the call, you can tag anybody. So now I move to my last round of questions, and I will start with Doc. Doc, so what I would like to know is that if we want to make more lives possible through FP, what is one shift that must happen from governments, donors, community? So specifically for you, maybe you can focus on when it comes to health systems and then the domestic financing angle. What is one shift that we should see? And then we'll say that because of this shift, now family planning will be made accessible across, irrespective of where a young person is, where anybody is, they can have access.
All right, so I'll give you my one thing that I wish. But I would like to say that right from the beginning, I've said a lot about the positives that Ghana has achieved when it comes to family planning. But beyond that, I will base my one thing on the youth, tokenism. Even though we have involved the youth a lot, we still have a lot to do. They attend our activities. A lot of youth are involved in FP activities. We have our adolescent youth corners and a whole lot. But then my one thing that I will say as a take home is about financing. So financing sustainable domestic funding, and moving away from the over-reliance on donors. So my one thing is sustainable domestic funding mechanisms, because that is what will actually provide young people the autonomy They have the agency, but then without sustainable domestic funding, they cannot do what they actually intend to do. So that is one major thing that will move Ghana forward when it comes to family planning and especially the youth.
Thank you so much, Doc. So what's Doc the shift that Doc wants to see is sustainable domestic funding mechanism. So we can do everything, but if we do not have domestic funding mechanisms to ensure that we have commodities continuously in country to enable access, then that would be a huge gap. So that is Doc's call to action for us. Now I would move to Mrs. Onye. Mrs. Onye, would you also like to share with us what shift would you like to see? And you can center on policy and equity access, beyond, the health, the economic justice and empowerment. What shifts would you like to see that you would say that, because of this shift in family planning, it will be accessible to everyone, irrespective of where you are, who you are, the country you're from? What shift do you want to see?
Yes. Thank you so much. Can you hear me?
Yes.
Okay.
You are very audible.
Yes, I think in a sentence, I think I want to see us decolonize the conversation around family planning. Just in terms of explaining what I mean, the family planning conversation has really been, I would say, from the north to the south. It's really been led by external donors. So when I say we need to decolonize the conversation, we need to shift the power of, first of all, who is defined as an expert when it comes to family planning, but also who is making the decisions, whether it's funding decisions or decisions about who gets access to what type of method. I think really, oh, okay, I think he has muted himself. Yes. So for me, what that looks like is even the language that we used to speak. I'm very passionate, well, let's call it passion. I'm very concerned about how we are reaching grassroots communities with family planning conversation. And one of the things I've done about that is through my nonprofit organization, we started what we call the Indigenous podcast. And the whole idea is to talk about sexual and reproductive health and family planning in local languages and actually record stories, the real life stories of young people and how they are engaging with family planning services or methods. I think when we shift to this local community-led focus, we will start to see greater understanding of why family planning matters and also a greater uptake of family planning methods. Like today, as I planned for this session, I asked people like, what has been the impact of family planning? And some people just said, really, like family planning, they only think of it in the negative because some people have used the method and they suffered side effects or they ended up getting pregnant. And I know that all of these things is as a result of miscommunication or disinformation and also misunderstanding. So we really need to shift. And the practical way we do it is ensuring for us as Africans, let us be the ones controlling the narrative. When it comes to even what gets funded in terms of the programs, we know our communities, we know what works in a particular community. So not just because Gates Foundation is giving us money or another international entity and they tell you, oh, we want you to use this innovative method or do this program that we've come up with. We have to start challenging this. And also when it comes to money, how are we challenging our own governments and our own leaders to raise the money that we need to address the reproductive health challenges that we're facing in our countries. So yeah, so I think that's what I want to see in terms of policy shift, a policy that doesn't look for help or support externally, but focuses on the country. And when we do that, we also confront this legacy of control, because right now, family planning programs in our countries, they are being controlled by external factors. But we really need to reclaim the agency and the narrative in order to see the kinds of rights and access to justice that we want in our community. So yes, I'll keep it at that.
Thank you so much, Mrs. Onye. So we need to decolonize the conversation around family planning. So I think it's taught more of the narrative shift and owning it like we actually want it, and not just about the fact that, you know, it's been brought by a certain group, or we are doing it just to, you know, mark indicators because the money is given by certain donors. Thank you so much.
Right. Sorry. Oh, yeah, sorry. Pesha, I just wanted to add as you were speaking. Yeah, we have to own it in the sense that we have to own that we are facing a crisis when it comes to teenage pregnancy, when it comes to sexually transmitted infections, even issues of do we have enough resources to nurture and take care of our population. So we really have to own it. We don't need America or the UK to tell us, oh, you guys have a lot of pregnancies or you have HIV, like HIV is out of proportion. No, we know our problem, so we just need to own it and then do something about it rather than waiting for a handout. Okay, I'm done.
Thank you so much. So my last but not least goes to Jitum. Jitum, so just give us your call to action. What is one shift you like to see when it comes to youth? So in the general FP space, basically, but what's one shift you like to see with young people when it comes to family planning?
Thank you, Patience. If we can solve this problem, we can end the subject of misconception surrounding family planning. And then all of the girls we know in our communities will stay in school and our society will become prosperous. That is meaningful males' involvement in family planning. Too often we feel, oh man, family planning is just about the girls. You know, it's a woman subject. Men should not be involved. But it's important for us to know that the sole perpetrators of teenage pregnancy are the boys in our communities, the ones riding the keke, the motorcycles. We need these people to be educated. I went to a village 2 years ago and I saw 5 girls in that village pregnant at the same time. And quite frustratingly, they live in the same house. You can imagine such a situation. So it's important for us to bring the males, you know, I mean, at the same level as compared to the girls in terms of the information. They all need to know, you know, and how they can become very supportive to their female counterparts is very much important. And I like to close with domestic resource mobilization. Young people, we have the voice. You know, we got the energy, we got the power, you know, to make things happen. Recently, we saw how USAID funding cut affected almost everything. We now need to start to talk to our government to be very independent as they claim to be. Independent in the sense that they are allocating more money to family planning and sexual and reproductive health and rights in our respective countries. Participants, colleagues, if we do nothing, nothing is going to happen. So let's use our voices. Let's use our skills because we need to live in a world where every girl and every woman can decide how many children to have, when to have those children, by whom, and just live a prosperous life wherever. Thank you.
Thank you so much. I really thank you so much, Jitom. So what Jitom wants to see is engaging men as allies. Engaging men as allies. The conversation should not just focus on the girl child or on females, because Of course, a girl cannot get herself pregnant. It takes two to play the game. So we need to bring men as allies. And most importantly, young people as advocates for domestic resource mobilization. A very big thank you to my panelists. I think this conversation has been very fruitful. I would give just 5 minutes for questions. I don't know if anybody wants to ask a question, wants to make a contribution. Is this something that was not very clear you would like to raise? You can always use the reaction to the react icon to raise your hands, and then you'd be called in. Right, so I see Buya. Buya is the FP 2030 Youth Focal Point for Sierra Leone. And Buya, you have the floor. Buya, we can't hear you if you are speaking. Can you unmute and speak? Right. As Buya is trying to settle his network issues, if there is any other question, you can always raise your hand, use the react button, raise your hand, and then you can get called in to share your question or your contribution. Any questions? Can we get reactions to show that, you know, we have enjoyed the sessions? Any reactions? Right, I see reactions coming in to show that we have enjoyed the sessions. Okay, unfortunately, I don't see Buya still on the call. Okay, he's trying to get back in. We would wait for him to ask his question before we officially close the session. Buya, you can speak if you can hear me. You have the floor. Buya, we can't hear you if you are speaking. Right, so we had a conversation on beyond contraception, what family planning has made possible. And we were hosted by Repro Health Unfiltered. They have all their links in the chats. All the links are in the chat. So you follow Repro Health on TikTok, on Instagram, on LinkedIn, on YouTube. And their email is also available if you want to collaborate with Repro Health at any point in time. There's a question necessary to reach you that you would like to discuss. You can reach them out via the various links that they have put in the group chat. So Buya has texted here that, thank you, team. I wanted to add that family planning and sexual and reproductive health and rights should be extended beyond health, it should be extended beyond health and should be across all other development priorities. I think that has been extensively discussed here in the discussion. So once again, a big thank you to my panelists who were in the persons of Dr. Amatefio Ameli Doris. I hope I got the name right. And Mrs. Onyinye Ede Vincent. And then we have Jutom. As for Jutom, I'm not able to mention the last name. I don't want to murder his name, but I want to say a big thank you to my panelists for
okay, so it's Doten. It's Doten.
Doten. Okay, Jutom Doten. Thank you so much for making this session very interactive. Please follow the Made Possible by FP campaign. You can search me on LinkedIn, Instagram, on Facebook with my name, Patience Ampuma, and follow keenly. We are making so much noise. We are changing the narratives. You can also, if there is anything you would like to say about family planning, please do. Let's reach out to the policymakers. Let's change the narratives. Let's ensure that we find ourselves in a time where we have contributed to FP access in the various countries that we come from. I'm happy to have been your moderator for today. My name is Patience Ampoma, and I'm the FP 2030 Youth Focal Point for Ghana. If you represent a CSO or you represent a youth-led organization, you can reach out to me at any time, and we can collaborate on how to better expand or better ensure that we are providing access when it comes to FP for young people. So Onyinye has also put her LinkedIn in the chat. You can follow her on LinkedIn, and let's get interactive on social media. Thank you all so much. I bring the discussions to an end. It was nice meeting you. For those who can share their pictures, you can share your pictures, and we could take a group picture, and then we are done for the day. So for those who can enable their videos, you can enable your video. We take a group picture, and then we are done for the day. Right. Shout out to all the people. So shout out to Abiba, to Nadu. Thank you for hosting us. She's the convener for Repro Health. Thank you, Mrs. Menu, for hosting us. I can still see Doc on the line. Thank you, Doc. Emmanuel, Lillian, Nima, Chantel, Gideon, Ava from Ghana Health Service. Thank you so much. Takia, Abdullahi, Jemima, Ametepe, Peace. Thank you all so much for joining in today's conversation. So has the group picture been taken, Nadu? You on mute?
Yeah. So I hope everyone's camera is on. Okay. So a moment. Let me I have to change the setting.
Please, let's put on our videos. Let's enable our videos, those who can. And let's take a beautiful group photo.
Okay. I don't know why it's just taking just me, but I think please a second, everyone.
I think it took just me too.
I'm changing the view. Aha, perfect. Okay, so a moment. Oh, wait, I got it all wrong. Yeah. Sorry, guys, just a moment. Oh, I don't know what is happening. Okay. Okay. And last one, just so I have enough. Keep smiling, keep cheesing. Okay. All right.
Right. Thank you so much, Mrs. Menu, for helping us with our picture. So we have got the session to an end. See you next time in any of our spaces. It can be an extract, it can be a webinar, but make sure that you come and you do not come alone. You come with someone to also participate in the conversations. Bye.